As the coronavirus pandemic took the world by storm, for the first time, many people in developed countries understood what it is like to lack access to essential medicine they need to survive. For people in poor countries, lack of access to medicines has always been a problem. This podcast explores the access to medicine issue and how we can promote global health more broadly. Famous scientist Marie Curie once said, "Talking is the best medicine." In this podcast, we will heed the advice of Curie and discuss how we can ethically and effectively tackle the health challenges currently affecting our world. Throughout this series, we will break down and explore fascinating new research being conducted by leading researchers and activists in the diverse field of public health who've dedicated their lives to understanding the problems and identifying the solutions to health crises that impact millions of people around the world. So sit back and enjoy this episode of Talk is the Best Medicine, brought to you by Global Health Impact Project in partnership with Planck-SIP.
Today, we'll be discussing the ethics of treating vaccinated and unvaccinated differently. While vaccination cards or certificates are mandatory in some city limits in the United States, other cities are still debating whether it's ethical to deny access to particular services based on vaccination. Is it ethical to treat vaccinated differently than unvaccinated? Should we be concerned with stigmatizing the unvaccinated? In what scenario is it ethical to impose mandates on the unvaccinated? These are some of the questions we'll be discussing today with Dr. Samia Hurst. I'm excited to bring you Dr. Samia Hurst. Dr. Hurst is a physician, bioethicist, and chairs the Institute for Ethics, History, and the Humanities at the University of Geneva in Switzerland. She is a member of the Senate at the Swiss Academy of Medical Sciences, of the Swiss National Advisory Commission on Biomedical Ethics, and vice chair of the Swiss COVID-19 Science Task Force. She tweets at Samia Hurst. Today, I'm going to be talking and speaking with Dr. Hurst about policy, COVID task force, and vulnerable populations and more. Welcome, Professor Hurst, to the show.
Thank you very much for having me.
Based on your career and experience as a bioethicist and a medical doctor, could you tell the listeners and the viewers about how you got into the field and a little bit more about your background?
Yeah, so I sort of fell into public health twice in very different ways. I studied medicine in Geneva, and when it came time to write my MD thesis, I actually worked on a public health problem. I had enrolled in an optional course in tropical medicine, and I went and did analysis of drinking water in rural areas and home storage, something completely from a past life now, as it were. And then I finished my clinical training. I became an internist, decided to become a bioethicist. I went to train in bioethics. My very first project was looking at an issue related to fairness in a health system issue. I looked at bedside rationing, clinical bedside rationing, and how clinicians viewed it, what their experience was with it, what they thought about it. And this became part of a thread in my research for, until now, really, one of my strong points is looking at ethical issues in health systems. And so when COVID came around, I was one of the ethicists in Switzerland, not the only one, but one of the ones that were already looking at issues related to ethics in distribution, ethics in health system, and ethics in public health. So these were two very different stories at two stages in my life.
That's very interesting. Let's get right into the article that we read in preparation for this conversation. You mentioned in your article from 2020 that immunity passports and certificates will make travel dependent on vaccine status for COVID-19. Many vaccinations are required to visit specific countries. To give us a baseline for your thoughts, do you agree with any visa requiring vaccination to travel to foreign countries? If so, which ones? And you mentioned yellow fever. Do you agree with this requirement?
Sure. So this is actually, I should say, not an article per se. This is a policy brief from the Swiss COVID-19 Science Task Force, which we might get to talk about a little later on. But this was co-written by a number of people early in the pandemic. I will be able to give you an update later as well on later versions. But initially, one of the questions was, what happens when some people start being cured and have immunity against SARS-CoV-2? Is it justified to keep these people in lockdown or semi-lockdown when they are no longer really a danger for others? So this was a hypothetical initially. We didn't know whether or not being cured also diminished the risk of transmission to others, not just the risk of becoming ill again yourself. So there's a lot of open questions in this initial publication. But one of the questions was indeed, so is it okay to have requirements for vaccination to travel? And these can have different reasons. So they may be to protect people during the flight, but that's not the usual reason, though, is it? If you are required to be vaccinated against yellow fever, it is so that you will not catch it in an area where it is endemic. Or it can be also because the country does not want you to bring it in when they have been successful in controlling it. And those reasons are usually deemed acceptable. But again, it's not an essential part of most people's lives to travel precisely to that country where vaccination is being required. And one of the really interesting ethical issues around immunity certificates or COVID certificates, there's been a lot of evolution around how these things are implemented today, is what sort of thing can they give you access to and yet remain justifiable. A very dear colleague, Professor Vardit Ravitsky, put it very well. I think she said that we should project ourselves into the future and imagine once the pandemic is over, what would we find it acceptable that vaccination against COVID-19 be required for? And once the pandemic is over, once there is no longer a collective danger, once we have sufficient immunity in the population that there is no danger, for example, of overwhelming health systems, of diminishing access to care for everyone, once everyone has access to vaccination, including children, once all countries have access to vaccination, we probably couldn't really imagine accepting a requirement for COVID vaccination in any situation where we do not accept current vaccinations being required. And they are required in very few areas. There are some jobs for which you have to have some vaccinations. So I work in a hospital, and when the hospital hired me, they required me to be vaccinated against a number of things to which I would be exposed in the course of my work. And this was a so-called conditional mandate. So I wasn't compelled to be vaccinated. I was free to go work somewhere else, basically. But if I was going to work there, I had to have those vaccinations. And this is considered completely normal. This might be the case for COVID-19 in the future. It could also be the case that some countries require vaccination in order to help with their pandemic control. But it seems really strange if 10 years down the line, we still had to show proof of vaccination to enter a bar, say, because this is not normal. This is not usual. This is transitory. This is because there is an intercurrent situation now, which will be ended after a while, which we need to deal with.
Interesting. Yeah, you see. Okay. So going back to the requirement for travel, requiring vaccination for travel, in many wealthy countries that do have access to vaccines and vaccination is a choice. However, in the impoverished countries, access to vaccines is still difficult. How will requiring immunity passports affect populations in countries that do not have access to vaccines?
So this actually very largely depends on who is able to get an immunity certificate. And this is part of the evolution that these documents have had. And we now have a variegated situation in the world where not every country has the same rules for what counts as a COVID certificate or an immunity certificate. So when we started thinking about this, we were really thinking about immunity certificates, proof of immunity. So either you are vaccinated or you are recovered or you don't have access to it. And this does mean that if you are neither vaccinated nor recovered, and if it's required for travel, you're basically stuck where you are. And this actually does, in that situation, in that scenario, it does massively increase already existing inequalities in how well different passports enable you to travel. There are lists and rankings of this which can be accessed, which are truly eye-opening and interesting about how many places in the world you can actually travel with different kinds of passports. And there are vast inequalities pre-pandemic, which the pandemic just exacerbates because the countries from which it is harder to travel out just also, of course, happen to be the countries where vaccines are scarce. And so it means you're also, if you're less likely to have a passport, a national passport that enables you free access to the world, you're also less likely to have a vaccine and therefore an immunity certificate. Now, if you add the recovered part, already you're a little more accessible. And if you add, as many countries have, if you add the tested negative part, then you truly become accessible even in places where vaccines are scarce or non-existent. If you can have access to travel with a negative test alongside the vaccination and the recovery, then you no longer have to have access to vaccination in order to have access to the certificate. And this is one of the rather latecomers to the discussion. When discussion started on immunity certificates, it was really just recovered. There was no vaccination yet. And one of the fears, indeed, at that time was that people might try to catch COVID-19 on purpose in order to have access to such a certificate. And this, of course, would be a very bad thing for themselves, because, of course, you would then have put into place a system that encouraged people to go court a potentially lethal disease. And that's a very great responsibility to take. But also at a time point when everyone was trying to flatten the curve and avoid overwhelm of the health system, it is not good common sense from a public health perspective to give people an incentive to go become ill. And so that was one of the reasons why the first position many people took was a very skeptical one. One that was very withheld, right? It's not a prudent thing to do to give people encouragement to become ill in the middle of a pandemic when you have no treatment, no vaccine, and very full hospitals. Nevertheless, there were already voices at this stage saying, but hey, the alternative is to maintain restrictions on people's freedoms even when they have ceased being a danger to others. Because the minute you have data showing that if you're recovered, you won't become ill, and if you don't become ill, you're no longer contagious, then the justification for keeping you locked in disappears. After all, the only justification is protection of third parties. If there is no longer any protection of third party hand, then part of the justification is gone. And so the discussion is already live at that time, and a lot has changed since then.
Right. And do you feel fairly confident that the progression of this will actually end up in that easement of restrictions?
Could you rephrase the question? Because there are many ways of understanding it, and I'm a little confused here.
Yeah, it seems to me that you're moving in a direction that that says the restrictions that are placed on communities will be restricted. It's not something that is forever. So,
Yeah.
Do you see this as a relatively short-term inevitability? From your position of as an ethicist?
Okay, so yes, so there are indeed two ways of understanding this, and let me take them one after the other. Why is a pandemic a threat? It is a threat because there is a novel disease for which most of the population has a naive immunity, right? So we don't have no defenses at all. We all have innate defenses, but they are not trained specifically against that disease. And that is why we become ill a lot at the same time, and we can become severely ill as well. Perhaps one way to think about it is to think about current childhood diseases. Childhood diseases are well known for being less severe in childhood than they are if you catch them as an adult. And in medicine, we know that if people immigrate from an area in the world where a disease that we call a childhood disease here is not endemic, these people are at risk of catching the disease as adults and becoming more severely ill. And sometimes they even die of diseases that we consider benign because we catch them in childhood and they don't threaten us very much then. Now, a pandemic is a little bit like a childhood disease that nobody's had yet. And so it means that everyone is catching it at whatever age they happen to be at, with varying degrees of severity. And actually, COVID-19 has this profile of increasing severity with age and may very well end up becoming one more childhood disease that we consider like the other ones, and for which we sometimes vaccinate our children and sometimes don't. Right? It could end up like that. It's not more severe in childhood than later in life. It's the opposite. But since we're all non-immune, it threatens us all at the same time. It threatens the functioning of societies because if too many people are sick at the same time, nothing can work. Hospitals cannot function correctly if they have a surge of patients that overwhelms them. And people become scared when too many people get sick and they stop going out, they stop consuming, there is a drop in demand, the economy also tanks. And so there is a large threat that is entirely due to the novelty of the disease. Once enough people have acquired immunity, either through becoming ill and becoming recovered or through vaccination, which is, of course, the safer path, then you no longer have this risk. You have exhausted the ground under the feet of the virus, in other words. So once there are no longer a sufficient number of potential victims who are susceptible, then it becomes a disease like any other disease, like measles, for example, where there are regularly epidemics, but of a small scale. They do not overwhelm societies. They do not overwhelm hospitals. You close a couple school classes for a couple weeks. You encourage everybody to vaccinate again, and then it's over, basically. That is when a pandemic ends. And all these anti-pandemic measures that countries have been putting into place are there in order to protect societies from the pandemic aspects of this novel disease. Once the danger has dropped, it may be that many people will still feel safer wearing masks in the winter, right? But there will no longer be any justification for strong collective measures that compel people to behave in one way or another.
Well, thank you for that. Okay, so in your report, I want to talk about assumptions for a minute and whether or not the vaccinations will cut down on transmission rates. Are you aware of any fundamental assumptions? And let me elaborate a little bit here. So I understand that your report was written before mass vaccination data was available, and I believe you have a few updates that you can shed some light on. With your research, now our literature research shows many articles that does cut down on transmission. Yeah. There was an article showing transmission rates are no different between vaccinated and unvaccinated if the viral load is the same. However, vaccines cut down significantly on viral load, and the number of days a person will be at peak viral load is also different. So can you help clarify your stance on whether or not there's any evidence we've missed that show vaccines do not reduce transmission?
Oh, no, absolutely not. They do decrease transmission. That's true. So the initial policy brief of the Swiss COVID-19 Science Task Force was written before there even were vaccinations at all. So there could be no data on a non-existent vaccine. And then there was a second position that took on board the fact that vaccination had arrived, but there was as yet no sure data showing that they decreased transmission. And that might bear some explaining, because we are very accustomed to having vaccinations that decrease contagion as a matter of course. But that is because we are also used to diseases that are mostly contagious while people are symptomatic. Most diseases are like that. You transmit them when you have symptoms. And because vaccination cuts down the risk of becoming ill, it automatically also cuts down the risk of transmission in those cases. But SARS-CoV-2 has a very annoying characteristic, it is able to transmit without symptoms. You are contagious a few days before symptoms show up, and it's very likely that you can also be contagious if you never become symptomatic at all. If you're a healthy carrier, if you manage to throw out the virus before it ever gives you symptoms, you can be contagious too. And of course, this means that a vaccination that had been proven effective to massively decrease the risk of disease could not simply be assumed to also massively decrease the risk of transmission. Because if it had simply transformed the sick into healthy carriers, they may have continued being contagious. And so unusually, there needed to be additional data gathered to check that question too. And this took a while. And in the end, the answer was the one we hoped for, namely, vaccination does decrease transmission. The protection against contagion wanes after a while, after the second dose. Not exactly the same in all age groups, and there are still studies from different countries that don't show exactly the same rate, but bottom line is we know it wanes after a while, and it goes back up after the third dose. And so there is a protective effect of others through vaccination. And this is a very important element, because this is why you can say, well, okay, you're less of a danger to others if you're vaccinated, and so there is less justification to maintain restrictions for you. And this is one of the bases of COVID certificates. Actually, in the country where I live, Switzerland, which is in Europe, there is a position that is mostly the European position, meaning that you can have access to a certificate if you have been vaccinated, if you are recovered, and if you have a negative test. And of course, the delays, the validity of the certificate is not at all the same in all these cases. So if you're tested negative, it's just a few days. If you are vaccinated and cured, it's now a year. But it means that the reason why you have access to a certificate is because you have shown proof of reduced risk of transmitting the virus to others.
Right. Okay. Just bear with me a second. Okay. So now, you mentioned that requiring vaccine certification would further disadvantage the currently disadvantaged. Can you go into a little bit more detail about this and which disadvantaged groups will be the most affected by the requirements?
Yeah, so this is one of the precautions that needs to be taken in the implementation of COVID certificates. And I'm really speaking here about COVID certificates, not just vaccination certificates. People who have less access to vaccination, people who have less access to tests, these people will be disadvantaged. And these may be people who have less access to the information. So, for example, if you do not speak the local language, or if registration is online and you don't have access to the internet, then you will have less access to vaccination and thereby to a certificate. If you're not a member of in a time when there is vaccine scarcity and prioritization going on. So, for example, in Switzerland, young adults were among the last to have access to vaccination. And they were therefore also among the last to have, they would have been among the last to have access to vaccination certificates at a time when everybody was very conscious of the fact that they really needed a break. They had been in lockdown, in telework for ages when their risk was rather low. So they had been doing this mostly for solidaristic reasons. And it was time for them to have also something in exchange. And it was a relief when our authorities announced that they would be putting into place a certificate with the 3 modalities. Namely, you could also have access through negative testing, which gave access to those who did not have access to vaccination yet. And at the time, tests were paid for by the state. This is no longer the case. And so this gives rise to another form of vulnerability, which is people who do not wish or cannot be vaccinated and who do not have the money to pay for regular testing. So testing is not very expensive, but it's not nothing either. And if you have, if you're very poor and if you have to count which bills to pay at the end of the month, you will not be able to afford even a small sum for testing, which means that financially access to a COVID certificate is not there for you. The reason why this decision was taken was that this was an arbitration and a conflict of values. Our authorities were well aware that this was a disadvantage, but they also wanted the side effects of taking away free tests, which was to encourage people to vaccinate more. And it did have some effect. So there was a trade-off there. Had tests remained free, there would have been greater access for everyone, but a lesser incentive for vaccination, and they chose the other route.
Right. Okay. All right. Yeah. So I was going to bring up that many people who choose to be vaccinated early on are very worried about associating with the unvaccinated in public areas. Now, whether this is justified or not, we could set that aside for now. This can reduce activity for businesses and the economy. Would separating vaccinated from unvaccinated allow for individuals to feel safe going out into public again, or increase spending at local businesses and add to the economy? This can theoretically help fund programs to assist unvaccinated receiving healthcare after infection. So, what are your thoughts about that recovery of the economy?
So currently, it's important to note that in the Northern Hemisphere, at least in the West, cases are on the rise again. And since people who were vaccinated early on are likely to be 6 months or more than 6 months from their second dose, it also means that they are in a situation where vaccine protection is slightly less. And so it is justified to be a little concerned again, because case numbers are getting so high. That means that the density of virus circulation is high again. It means the likelihood that you will meet it, especially in enclosed spaces, especially when you're breathing in there with many other people where it's poorly ventilated, where people aren't wearing masks, the risk becomes really high. And so rather than separating the vaccinated and the unvaccinated, we would be better off, in my opinion, thinking about how to protect all of us in such circumstances. And this is not new anymore. We know how to do that. It's about ventilating enclosed spaces properly, when needed, verifying it with CO2 sensors to make sure that exhaled air, the air that's already been in somebody else's lungs, does not rise to too high a concentration, because this is also what is a marker for a risk that you will also get exhaled air that is contaminated. Wearing masks, not meeting too many people, sort of parsing out whom you meet by importance while case numbers are high, whether you are vaccinated or not, especially since protection of others through vaccination does also wane. It can go as low as 50% from a high of 90% 6 months after a second dose, which means it's really prudent to start wearing masks again if you are vaccinated, not think that the vaccination is going to be the only protection you need at this stage of the season. It also means it's a good idea to get the third dose. It's a good idea. Vaccines that don't replicate in our bodies actually need 3 doses. And we never thought twice about it before. So this is not wholly unexpected that this one needs 3 doses as well. Separating the vaccinated and the unvaccinated is also problematic because it creates separate paths in society. And a society that has decided to not make vaccination compulsory, and in Switzerland, we can really say that. We actually voted on a law on epidemics in 2013, so not that long ago. And in the debate, the central issue that everyone wanted to talk about was, should it be okay, should it be allowed to make vaccinations compulsory or not? We were thinking about a future theoretical epidemic back then, right? So it may be different now, but back then, the answer was a resounding no. We do not want the possibility of making vaccination compulsory for the whole population. The law does contain, and we also voted yes to that, it contains the legal possibility of making vaccination compulsory for 3 subgroups: those more likely to die, those more likely to catch the disease because they're exposed professionally, for example, and those more likely to transmit it and who are, for example, treating people who are vulnerable. But there is no legal basis for making it compulsory for everyone. This means we sort of decided together that it would be okay to either be vaccinated or not vaccinated, despite the fact that it was very clear that there is a route that is safer, right? But people are free to choose. Since this was a collective decision, it means that, yeah, we sort of have to go through the pandemic together with this collective decision, and that means with both vaccinated and unvaccinated people. And because the protection of the health system and access to care is considered here to be a right, to be a common good, it also means that we have to do this together for everyone, vaccinated and unvaccinated, whatever disease brings us to hospital in the end. Even here, there have been some discussions of whether there should be more priority for intensive care beds for vaccinated COVID patients than for unvaccinated COVID patients, under the header, under the title of, well, it's their own fault anyway, right? Mm-hmm. This did not come from the medical community. It did not, of course, come from the bioethics community, but from the general public, a few politicians. And this is actually in complete contradiction to the idea I've been outlining there. If we have decided together that it would be legal to not be vaccinated, we cannot then punish people who do not choose to take vaccination.
Well, it seems to go against a maxim in the medical community of do no harm. Really, I don't know how a medical community could actually do that. So.
I'm not sure technically. I mean, I'm going to get a technical. I don't think it transgresses the do no harm principle because it's not active harming, but it is still against the central mission of medicine because we're not into punishment. Mm-hmm. And even when we treat hardened criminals who have been tried in court and found guilty, we still have to treat them in an equivalent manner to everyone else. And here we're talking about a decision that is not a crime. And moreover, we're going to be talking about people who would have to be assessed for whether it was, quote unquote, their own fault or not, without having the right to a hearing, a lawyer, a presumption of innocence, all of the stuff that hardened criminals get, right? Mm-hmm. And so there are multiple layers of problems associated with such an attitude. And that is why in the last medical ethical directives of the Swiss Academy of Medical Sciences, we actually had to write it. Right? We had to put it in writing that it was completely excluded to treat people who were vaccinated and unvaccinated differently. And we also have a position of the National Bioethics Commission in Switzerland saying very much the same thing. But this is something we would not even have thought to need to write 5 years ago. It would have gone as a matter of course, but these days you have to write these things.
Yeah. Okay, I'd like to focus on one scenario you considered in the report, which assumes vaccines are shown to reduce transmission. This is a scenario too in your report, which briefly says, if there's enough vaccines for everyone and there's enough vaccinated that COVID-19 cases do not overwhelm the healthcare system, being unvaccinated should be a choice, and which you've already gone through, and vaccination cards are not required. The argument against this is that many virologists suggest that the predicted herd immunity threshold is around 80 to 90%, given the effectiveness of the vaccines and the transmission rate of COVID-19. Now, this rate considers the Delta variant, but not the Omicron, which such a high herd immunity threshold, pockets of highly unvaccinated groups could exist where COVID is less likely to spread. Thus, the need for vaccination certificates to encourage unvaccinated to become vaccinated is thus avoiding these pockets. How would you respond to all of this new information and the introduction of Omicron into the situation?
Very interesting question. So first, yes, we did outline that, and there really isn't much that has changed to that. The idea was here that if there are no longer enough susceptible people to pose a collective risk, so a risk to access to care, then asking people to have an immunity certificate or a COVID certificate in order to access certain places was basically asking them to do something to protect themselves. So it becomes the equivalent of seatbelts rather than the equivalent of speed limits on the motorway. So Speed limits are there to protect yourself and others, so they are analogous to vaccination in this sense, but seatbelts are just to protect yourself. They don't protect others. And this, of course, means it has a weaker justification in terms of limiting people's freedom of choice. And indeed, speed limits on roads were much less controversial than seatbelts were when they were introduced because of this dimension precisely. Now, it's true that we did not take into account the necessity that could arise to use certificates as a pressure for people to become vaccinated on all routes, as it were, to having greater collective protection. Why did we not do that? Because that would require a whole other discussion, which is what is the most effective and ethically justifiable way of getting unvaccinated people to vaccinate? And we were not considering COVID certificates primarily as a tool aiming to do that. Of course, they have this side effect, but this was not the purpose here. The justification was an epidemiological one, making sure that there are fewer people who are contagious in a gathering, especially if the gathering has to be held without masks indoors. In a way, this is sort of the equivalent of what has happened forever for tuberculosis cases. So if you come into an emergency room and you're diagnosed with active contagious tuberculosis, they're not going to let you leave. They're going to put you into an isolation room. And once the diagnosis is confirmed, you'll be told that these are the medications that are strongly recommended, and they will make you not contagious faster, but you're not leaving the room until you're not contagious. Right? I spent a night like that once. I was mistakenly diagnosed with tuberculosis, which I ended up not having. But I spent the night in this form of isolation. It's very uncomfortable, but it is necessary because this is how we stop contagious diseases from spreading. Now, this we can do because there are few cases of tuberculosis. There are many, many cases of COVID-19. Imagine if everybody was isolated, what it would do. We would also have to systematically test everyone much more frequently, and societies have not gone for that in our neck of the woods. But the closest equivalent is to say, well, if you haven't shown proof of low risk, you can't go into a risky place. But it wasn't as a way of convincing people to become vaccinated. If we're going to think about how to make unvaccinated people vaccinated, then we have to talk about other alternatives. We have to talk about vaccine mandates. We have to talk about how people who do not vaccinate under a vaccine mandate would be treated. This can be very different. So people always imagine if there is a vaccine mandate, it means people will force you. I mean, they will really stick the needle in your arm by force. Nobody does this. Even in places where vaccines are compulsory, nobody does this. At most, you have to pay a fine. Sometimes the fine is cumulative, so this becomes a very strong incentive, especially if you have little money. But I also lived through a time in my part of Switzerland, in Geneva, where there was a compulsory vaccination for children that was implemented with no sanctions at all for people who did not comply. Basically, people who did not vaccinate their child against diphtheria, this was the compulsory vaccination, got a very strongly worded letter from the health authorities and had the legal obligation to vaccinate their child. And parents tended, on the whole, to go to pediatricians and ask for the vaccination once they got that letter. But if they didn't, what happened to them was nothing. And so this also shows that you can have a mandate without a punishment and it still works. And there are other ways. So then we'd have to have that discussion. The purpose of immunity certificates is not that. It's not to be the way by which people get convinced to become vaccinated.
I think that's a really important, it's a really important perspective that people need to understand. So another argument we could make is for those that do not create antibodies in response to the vaccine, which is tens to hundreds of thousands of people. We can also include the very few that are advised not to be vaccinated due to treatments for pre-existing conditions such as immunity compromise or cancer. Again, assuming that these vaccines reduce transmission, can we, well, I guess we're not assuming, we actually have that information, as you've explained. Can an argument be made that vaccine certificates will create safe spaces for these individuals?
They create much safer spaces. It's important to realize that a COVID certificate is like a volume button on the risk level. It is not a light switch. As a matter of fact, most of the tools that we have in fighting this pandemic, and indeed many of the tools of medicine itself, are volume buttons rather than light switches. So if you are vaccinated, you are at much lower risk of transmission, but not at no risk. If you are cured, if you're recovered, you're at much lower risk, but not at low risk. If you're tested negative, you're at much lower risk, but not at no risk. And if you come into such an event that is protected by a COVID certificate without trained immunity yourself, if someone contagious does happen to be there, you're going to be the one who gets sick, right? So you have to be aware of that. And mask wearing, especially the medical masks, as opposed to the FFP2 or N95 masks, they protect the wearer somewhat, but they are more effective at protecting others. And so if people are going to come into COVID certificate events without trained immunity on the basis of a negative test, and people who cannot develop immunity following vaccination will be in that category. They will need a test to get in. And where I live, that test is still paid for by the state because it's not their decision to not be immunized. So they still get free tests, but they do need to test. And they will be at risk if someone contagious is there. And so it means it's in their interest precisely that when case numbers go up and when the volume button still leaves the risk loud enough to be significant, we should really all be masking up, even in certificate events, whether or not we are ourselves at risk, because this is also altruistic behavior to protect the ones who come in with a negative test and who are the ones who will get sick if somebody is contagious in that space.
Yeah, very interesting. So I like your point about the vaccination, that everybody should have access to goods and services. I'm wondering, do you see a difference between essentials in a supply chain, such as grocery stores and essentials, versus luxury events where, large crowds gather and transmission is high, movie theaters, sporting events, bars, and concerts? Are these restrictions also unethical in your mind?
Yes.
Yeah,
so
isn't it? Yeah.
There are two really important questions there. So once we move from can it be okay to use certificates to when is it okay to use certificates, these distinctions do arise. So, of course, it's crucial that everybody has access to basic goods and services and to fundamental rights. We would not accept a condition of a certificate to have access to food or to have access to things like voting rights. So those are two very different things, of course, but they are both essential and should be protected for everyone. And so this is a major important restriction on the use of COVID certificates that have to apply. You cannot bar people from essential goods or fundamental rights. This does bear repeating because in previous epidemics, there have been cases where villages have been isolated in order to contain things like Ebola, for example, without access to drinkable water. So you do have to remind people of this. When people get scared and emotions do tend to get forgotten. Even in highly democratic Switzerland, there were weeks at the beginning of the pandemic where there was a limitation set on the right to gather among people, right, on the number of contacts you could have, without an explicit exception for political demonstrations. This was set right quite quickly, but it just goes to show that access to political rights does need to be explicitly protected because these things tend to fall off the radar, even in countries that are highly conscious of it. Amnesty International gave us a black mark for this. I think they were correct. I was very relieved to see this corrected fast, and it's never been re-implemented. So even when we had very strict limitations on the number of people who could gather, sometimes down to 5, there was always an exception for political demonstrations, and we've had them, many of them. So there is this limitation, but this means you then have to make this distinction, right? So what is essential? What is fundamental? And there is a continuum there, right? So there is an agreement that it's fundamental to be able to eat. There is an agreement that it is not fundamental to be able to go on an exotic vacation. But of course, there are many, many things in between, and debate is open on where the threshold ought to be. When you have a threshold to set, you know that you will have disagreement among reasonable people on exactly where it is set, but it doesn't mean the distinction doesn't exist. One way of putting this is to say, well, evening is a transition between day and night. It's hard to know exactly where day ends and night starts, but it doesn't mean night and day are the same. Right? Mm-hmm. So the fact that the border is blurred does not mean the distinction does not hold. But it is an important thing. The other distinction is, when could you also protect people without the COVID certificate? Because you're going to be excluding some people. If you have an alternative to protect everyone, this is preferable. And this would apply, for example, to outdoors events. It would apply under some epidemiological circumstances to indoors events where masks can be worn and where ventilation is good. But this will cease to be the case if case numbers rise a lot, where circulation rises a lot and risks rises with it.
Right. Okay. Now, you do bring up, I'm glad you bring up the private sector. I'm really curious about how you would approach this. If I get you correctly, requiring vaccine certificates for private sector is unjustified. However, from the position of a business owner, if they do enforce this because of a perceived risk, how do you approach that?
The distinction doesn't necessarily go through private versus public. It goes through whether the service is essential or not. And it goes through whether it can be protected in other ways just as effectively as through a COVID certificate. There is a distinction made in the policy brief because we wrote it in the Swiss context. And there is a legal difference in the framework that applies to the public sector and the private sector. This will change from country to country. But in Switzerland, there are very strong protections of access to basic goods and services in the public sector. But there is no such protection when it is the private sector, which means that grocery stores, for example, which are private, could, in theory, have all barred access to people who did not have a COVID certificate. They could even have said, we won't accept the unvaccinated. It would not have been illegal. And this was very concerning to us. Of course, not because we thought it was highly likely that they would do so, but it seemed to be a legal loophole worth closing. That private sector entities that actually provide essential services might have to ensure that they are accessible to everyone, rather than simply being free to pick and choose their customers. If you're a hairdresser and you don't like the look of someone, you're not forced to cut their hair. But if you're selling food, it should perhaps be different.
Interesting. Okay. Mm-hmm. Can you address the privacy to one's own health records? What is your opinion on the vaccine certificates in relation to privacy? Would vaccine passports also violate this privacy? And finally, do you agree with vaccine passports for travel?
Yeah. So if you have literally a vaccine passport, right? And this was what we discussed initially early on in the pandemic. There was a lot of discussion of the privacy of the data, of how what the passport would look like, where the data would be conserved, would it be digital, would it be paper, or how would that work? But in the end, all of this is you start to treat people differently on the basis of health-related data. So if you have access to this space only if you're vaccinated and you're in there, it means you're vaccinated and everybody can see it, right? And so confidentiality does break down. Now, this is also something that is resolved by the access to certification through being vaccinated, recovered, or tested negative, because once you enter that space, nobody can tell if you're vaccinated or not. Interestingly, though, in the implementation in Switzerland, we have a digital certificate, which just tells you, if you read it correctly, it just tells you yay or nay, right? So it's valid or it's not valid, you can come in or not. But actually, if you double click on it, it shows everything. It shows if you were vaccinated, recovered, tested, what the kind of vaccine you had, the date, everything. And this is something people are not supposed to be doing, but which people do tend to do because it's so practical to know if you must check tomorrow again. So if you go, for example, to a gym or to a hotel, they will always want to check because they want to know if they have to check tomorrow again, which is the case if you're tested, but not if you're in one of the other modalities. So we do have situations where confidentiality does break down, although the whole system was designed in order that it doesn't have to.
Right.
Mhm.
Okay. All right. Well, at this point, I'd like to bring up some questions that were submitted beforehand by the audience. So just so that we can get through as many questions as possible, and I believe we have 11 of them, let's try and move through them as quickly as we can. I know that's always a challenge because you have to answer them correctly. So the first question is, it states that if a sufficient proportion of the population is vaccinated to protect the health system from becoming overwhelmed, then there is no longer a need for vaccination certificates requirements except for certain cases. How do scientists determine what a sufficient proportion is? And does this exempt people from getting vaccinated because they will be under the impression that they don't have to if others do?
Okay, so it's possible to calculate, to estimate how many people are still susceptible in a population. And because we know at each age group how many people land in hospital when they get sick, it's possible to estimate how many hospitalizations away we are from the end of the pandemic. As long as this number is too great for hospitals to be safe, we're not out of the woods. And this is how you know that a sufficient number of people is vaccinated to no longer, so there is no longer a threat to the health system. This will vary from country to country because the hospitalization rate is not the same in every country and because the available hospital beds are not the same in every country. But yes, it is possible to estimate that.
Great. Okay. So the report also states that requiring vaccinations is only justified if the risk to unvaccinated persons could be mitigated by others less restrictive measures. Or other less restrictive measures. Does this mean that you could support a continued mask mandate and social distancing over requiring a vaccine?
So this is about requiring vaccine certificates. And the idea is that since it is a measure that makes differences between people, it should be considered to be burdensome from a societal and ethical standpoint, and you should prefer a less burdensome measure. And so yes, if, for example, you can protect a cinema or a theater just as well by either requiring a COVID certificate or by requiring people to wear masks inside, the mask is a less burdensome measure and should be preferred.
Okay, thank you. You state that if everyone has access to very effective vaccination and important justification for vaccination requirements no longer exists. Now, however, what about the mutations of the virus that could possibly make some vaccines less effective, thus increasing transmission and infections?
So this is a question that simply illustrates that a pandemic puts us in situations where circumstances may indeed change. Right? So we may face a situation where we have less collective protection than we had a few weeks ago. If indeed the Omicron variant has some immune escape, and this means that we have less protection if we are recovered or vaccinated. This could indeed happen. The reassuring thing is, though, that we're almost 2 years into this, and this is the first time there's a serious question of real immune escape, and it's not likely to be complete. And this means that because there is a vaccine technology there, that in a few months, it is likely that, quote unquote, Team Humanity can still be still in this thing.
Okay, that's good. How would you differentiate between the amount of harm reduced for a fully healthy individual compared to someone with a pre-existing condition?
Yeah, so the amount, well, this is actually a tough question because there are different kinds of pre-existing conditions, and the person who is healthy will not have the same risk at every age of life. So there are multiple categories here. What I can say to this, though, because I think the question comes from someone who is perhaps concerned, is that vaccination, the authorities that give authorization for medical procedures and interventions, the FDA in the US, and there are others like that all over the world, they can only give an authorization if the risk-benefit balance is favorable for the individual. They will not give an authorization to something that does more harm than good to individuals, even if there is a great social benefit for it. They will say yes only if for individuals there's a favorable risk-benefit balance. And so this is actually the case for every age group for which vaccination against COVID-19 has been approved. Now, the risk is, of course, less if you're young and healthy, but bear in mind that at the end of the day, we're all going to meet SARS-CoV-2. And the question is not is not so much just what are the risks and benefits of the vaccine, but what is the risk of the disease? It doesn't have any benefits. And so it's that trade-off that you should make. And you can throw in there, for good measure, the decrease in the risk of transmitting the virus to others around you as well, in making a decision.
Yeah, so the next question has to do with effectiveness. And I think, just to add what you just explained, there's several things that come into the ethical perspective of this. But we have one question here. It says, whether or not the vaccine is sufficient depends on the goals we define for it. Evidence has shown that the vaccine does not completely prevent illness, but it does reduce the severity of illness. Yeah. As you said, the vaccine is not 100% effective. How effective do you think the vaccine should be for lifting restrictions?
So the thing about lifting restrictions is it's not due only to the degree of effectiveness, of efficacy of a vaccine. It's due to the remaining burden of disease, right? How much potential does this pandemic have if we let it run? And does the potential still hold enough force to be a danger for our health systems? Now, this does mean that if you have a less effective vaccine, you have to vaccinate more people before the risk is sufficiently small to be taken. If you have a more effective vaccine, you can vaccinate fewer people to get there. And then there is the potential for a bad disease of the virus that also comes into the mix. And there is also how contagious it is, because how quickly people become ill all at the same time also is, of course, a very strong determinant of the size of the curve that you will have to deal with in hospitals. Now, this goes back to a point you made earlier, which I did not address, which is the question of herd immunity. And actually, technically, herd immunity means that you can be safe if you are susceptible in a population where enough people are vaccinated or immunized for a virus to no longer circulate. But this virus is able to circulate in the immunized. So the typical technical question of herd immunity in the epidemiologically strict sense is, once you have it, a tourist could arrive from a place where vaccination does not exist, and that person will be protected against catching the disease by the degree of protection in your population. If we think about when that might happen for SARS-CoV-2, the answer is maybe never. Because actually, if it can circulate in the immunized, the tourist who arrives unimmunized into a country where 100% of everyone is vaccinated or recovered could still become ill. Because they would be people who would have mild disease or perhaps no disease at all, who are still carrying the virus. So when we say herd immunity in terms of policy, this is actually not what we mean. When we say herd immunity in terms of policy, we mean that level of protective immunity in the population, which means that people are still going to get sick, sure, but not in sufficient numbers that we will need to close down wards and do only that and refuse other patients. Not in such numbers that parts of society might break down. And once that's the case, we may not have herd immunity in the epidemiologically technical sense of the word, but we have woods. We are no longer in a pandemic situation.
Okay. All right. So one reason that vaccination certificate requirements may not be permissible is because it may lead to societal stigma. Mm-hmm. Is this necessarily a bad thing? Would it encourage vaccination? Also, there are many people in society that are stigmatized, whether it be for religion, sexual orientation, mental illness, more. Is it the government's role to attempt to maintain a social cohesion in regards to such morally charged choice, or should it be the government be more concerned with public health during a pandemic first and foremost?
So I don't think these are completely incompatible goals, fortunately, but they are difficult to maintain at the same time. Mm-hmm. So first, it's possible to have a non-stigmatizing COVID certificate situation if it's not predicated only on vaccination. Right? If you can have it, whether or not you're vaccinated, then it doesn't label you as vaccinated or unvaccinated. But of course, the question is still valid. So what if we had only a vaccination certificate? It would label people. Would that labeling be wrong? We call something stigmatization when it is about negatively valuing someone for bad reasons. You could make a case that it's a bad idea to not be vaccinated in a pandemic. You're not doing as much as you could to protect others. Maybe the labeling is justified, right? Maybe you should be blamed for doing this. The problem, though, is that if that's what you think, then you might want to not leave the choice open. Another problem is that people who are unvaccinated sometimes have made a completely lucid choice in the face of high accessibility to not be vaccinated. But when you look at populations of vaccinated and unvaccinated individuals in various countries, a rather different picture emerges. It very much looks like differences in access, which tend to disfavor already disfavored, disadvantaged populations, who tend to be the ones who are stigmatized anyway. And so it tends to heap up disadvantages on the already disenfranchised. It's wrong in that sense to blame people for not having chosen vaccination when in fact they have lacked access to it, or have perhaps theoretically had access to it but couldn't take time off work, or might lose their job if they spend 24 hours with a fever, which could happen to them as a side effect. And so in that sense, yes, there is a moral problem in stigmatizing the unvaccinated. Also, yes, I do believe, but I do realize this could be a transatlantic rift here. I may have to say, as a European, I believe it is the government's job to maintain some form of social cohesion. Why is that? Because many of the things that we do together because we are able to cooperate as humans. This is one of our superpowers. If trust breaks down, if cohesion breaks down, we can collaborate less. We can do less things together. And this is a disadvantage. Societies exist in part in order to enable us to do things together that we would not be able to do on our own. And so, yes, it is part of society's job, in my view, to maintain the foundations of this trust and cohesion.
Okay, so I have one last question, and it has to do with vaccine passports. If vaccine passports are required in the future, how can we defend them to those who believe this is a human rights violation? How do you think about immunity passports overall?
So we should defend them by not letting them be human rights violations. We should not make vaccine certificates required for things that are human rights. We should, in other words, only accept them in areas where, as the imagination exercise I described earlier, in situations where before the pandemic we would have accepted requirements for vaccination outside of a crisis. And in that case, I think we probably won't have much difficulty defending them if they are limited in such a way. If they are not, then we might have to ask ourselves hard questions, because if we no longer have a collective interest in controlling case numbers because hospitals are not in danger anymore, if everyone has the possibility of being vaccinated, if we also have the possibility of protecting ourselves in other ways, then it would be justifiable to restrict the use of vaccination certificates and no longer require them in most places where they are required today.
Nice. Okay, well, thank you very much for your time, Samia. Unfortunately, we're running out of time. Before we go, I'd like to give you the opportunity to add any closing messages, remarks, or questions that you want to leave the audience with. Is there anything you'd like the audience to know, or is there anything that individuals can do to, proactively in this situation as far as you can see?
So I would like to leave you with a reflection exercise, because a lot of the debates that occur around COVID certificates are completely expected and really important, because at bottom, COVID certificates are about balancing different kinds of rights and freedoms for different kinds of people. It's true that we have freedom to move around and it should be respected. And it's true that we have the right to be protected against contagion and safe in areas, especially areas where we must go, like workplaces or schools. And when these two come into conflict, there is a balancing to be done. And it is not an obvious answer when the balance should go one way or the other. So the fact that there are societal rifts and debates around this is not unexpected at all. But it also means that it is a values conflict. There has to be a decision one way or the other, and the decision is going to sacrifice something. And so the question is, what is the most justifiable sacrifice in this circumstance? And pandemics put us in that situation all the time. We are living through values conflicts, right and left. And if we are working in ethics, it is something we're accustomed to. But for many people, it is the first time. It's as if we're collectively all with our back to the wall all the time, having to make priorities and decisions among values that we're not used to having to trade off. And this is a very uncomfortable position to be in. It is no surprise in that sense to have people who are fighting it, who are trying to deny the fact that the value conflict exists because they do not want to have to work through it. But it is there, and so how would you do it? Think about how you would balance the different values in presence if you had full powers. So imagine yourself dictator for a day. How would you balance this? What would you sacrifice and what would you protect?
Mm-hmm. Thank you again for joining us today, Samia. It was a pleasure to have you, and we'd like to thank the audience for joining us today. And we'd also like to thank our sponsors. This podcast series is a part of an epidemic ethics WHO initiative, which has been supported by an FCDO welcome grant, 214-711/Z/18/Z. I'm your host, Daniel Sanderson, and I hope you enjoyed this episode of Talk is the Best Medicine.
Thank you very much.
We hope you enjoyed this episode. To find more of our content or explore the exciting work being done by our parent organization, the Global Health Impact Project, you can check out our website at global-health-impact.org/new in the description below. The Global Health Impact Project hopes to continue to support efforts like this podcast to provide information about and advocate for access to essential medicines. Also follow the Global Health Impact Project's social media pages on Facebook, Twitter, and Instagram. Until next time, don't forget, talking is the best medicine.